Happy Tuesday morning. I am just finishing up my shift in the emergency room last night, and I am wondering how long these marks from my N95 mask are going to last. We were screening patients last night for COVID-19. Testing guidelines continue to be very, very strict. Unless you are floridly hypoxic, which is a low oxygen level, and you're needing to be hospitalized or possibly intubated, we're sending patients home with symptomatic management. According to NPR on Monday morning, over 1,000 deaths have occurred in New York State, the majority of which are in New York City. We were supposed to end social distancing on Monday. However, that's been extended to at least April 30th. New York City's program, New York City on Pause, is going to be extended for at least 2 more weeks per Governor Cuomo. Mayor de Blasio has started fining New Yorkers this week between $250 and $500 for anybody who's not abiding by the social distancing mandates. The CDC continues to recommend that anybody in New York, New Jersey, and Connecticut do not domestically travel. There's a new FDA rapid test which can populate in 10 to 15 minutes that's rolling out on Friday from Abbott Labs. That should allow us to increase our testing and liberalize our guidelines for who we're able to test to get a better sense of what's going on. The clinical trial results that are going on antivirals, remdesivir, antibody testing should be available in mid-April. That'll give us better information on protocols and optimizing treatment for patients who are in the hospital. The American Red Cross continues to need blood donations. So if you have found it in your heart to do this in the past, it's still safe to do so. They're taking appointments at your local Red Cross, and I know that they would love to have any help in donations as well. We're wearing a mask at all times. It's one of the surgical masks like this in and around the hospital. The USS Comfort arrived at Pier 90 in Manhattan. We're going to go check that out today. Non-essential businesses continue to remain closed in New York City for at least 2 more weeks until April 15th, but it's likely that that'll be extended until the end of April. The most concerning thing that I saw in the emergency room last night was how quickly patients can decompensate. They'll come in with low oxygen levels, and before you know it, they're having to be intubated. They're in florid respiratory failure. They're in kidney failure, multi-system organ failure, and then it's very difficult to reverse that course from the virus. We're seeing a lot of patients with mild to moderate symptoms, and unfortunately, because of testing restrictions, we are not able to know 100% if in fact they have the virus, but what we're doing is telling patients that it's possible and even likely that they do, so please behave as if you have a positive test, including being aware of close contacts, self-isolating, etc., etc. So everybody have an awesome day and stay positive. We've really loved the outpouring of support from everybody from local radio station DJs to restaurants dropping off food to messages from afar. So everybody stay safe, stay well, and we'll be in touch.